Hello.
Hi, Dr. Wang.
Hi. What brings you here?
Well, I'm not well. I feel tired.
Okay, so can I ask what do you do for a living?
I'm a teacher.
Teacher. Okay, so you speak a lot.
Yeah, I do.
Then how old are you?
29.
29. Okay. You do look a little pale,
Yeah.
judging from the complexion. And what's the color of your lips usually?
Well, I use lipsticks, but usually it looks light.
Light.
Yeah.
All right. So I need to ask you some more questions.
Okay.
Okay. Are you averse to cold or heat usually?
Oh, cold, I think.
Cold.
I like cold.
Okay. Do you sweat a lot?
Yes, when I move around.
Yeah, after exercise.
Yeah.
Then afterwards, do you feel like comfortable or uncomfortable after sweating?
Well, I feel even more tired.
You're more tired. Okay. Yeah, I can hear you speak in a low voice. Maybe because you speak a lot
Yeah, I speak a lot
as a
every day.
teacher. All right. So, how's your appetite?
Not well. I have a low appetite.
Low appetite. Okay. Do you like cold food or hot food?
Hot food?
Hot food for sure. All right. So, how's your bowel movements?
Oh, not exactly normal, I think. It's kind of hard for me.
Okay. So, what's the frequency?
Oh, every other day.
Every other day. Okay. Do you feel difficult to
Yeah.
push up? All right.
do.
Okay.
Yeah.
So for ladies, we need to ask about the menstruation. Okay. Is a period irregular?
Well, kind of.
All right. So how long does it last?
About 3 days.
3 days. Yes, a little short.
Yeah.
How's the color?
Light.
Light.
Yeah.
All right. Okay. Can I feel your pulse, please? Can I check your tongue again? All right. Light red with some tooth mark on both sides. All right. Thank you. So your pulse, a little thin and soft. The other one. Yeah, your pulse feels a little thin and soft. And judging from all the informations I get in Chinese medicine, you suffer from qi and blood deficiency. That's why you always feel tired. So my suggestion is take some food or medicine that can tonify your qi and blood. For example, ginseng, very popular for tonify qi, and something tonify your blood. For example, Chinese date. Okay.
Date.
Yes. And also, I will give you a prescription, and we have a very famous formula called the Four Gentlemen Decoction, especially good for tonify qi. All right.
Okay.
Okay.
Thank you very much.
You're welcome. The diagnostic methods of TCM. When discussing the great doctors, many Chinese people think of Pian Que. The name Pian Que originally referred to a legendary bird that could relieve pain. During the warring states period, there was a famous doctor named Qin Yueren, who was highly respected and was given the moniker Pian Que by the common people. On account of his medical skills, eventually Pian Que became his name. Once Pian Que traveled to the Qi state and met Duke Huan, after carefully observing the complexion of the Duke, Pian Que said, "Your Excellency, I find that you have caught a disease, that the disease is currently only among the skin and the flesh. But if it is not treated in time, the disease will get worse." Duke Huan said disapprovingly, "I feel no disorder. I can eat well and sleep well. How could I be sick?" 5 days later, Pian Que visited Duke Huan again and said, "According to my observation, your Excellency's disease has spread to your blood vessels. If not treated, the disease will get even worse." Du Huan still did not believe what he was saying and became angry with him. Another 5 days passed. Pian Jue met Du Huan again and said, "Your Excellency's disease has spread to your intestines and stomach. If not treated, it will develop even further and be hard to cure." Du Huan was very annoyed again. However, several days later, when they met again, Pian Jue did not say a word and then left. Du Huan was puzzled and sent someone to ask for the reason. Pian Jue said, "When I met His Excellency for the first time, his disease was in his skin and flesh, and could be cured with a medical compress. Then the disease moved to the blood vessels and could be cured with acupuncture and stone needles. When the disease moved to the intestine and the stomach, it could be cured with medicinal yellow wine and a decoction of herbal medicine. Today, when I met His Excellency, I found the disease had moved to the medulla and it can therefore not be treated with medicine or any other therapy. I can do nothing for His Excellency." As expected, several days later, Du Huan became ill. However, it was too late for the regrets. When he sent for Pian Jue, the great doctor had left for distant parts. Du Huan died soon after. This story shows that Pian Jue was able to follow the development of a disease just through observation. In other words, his skills of observational diagnosis were superb. This story is important because it shows the value of good observation. Indeed, among many diagnostic methods used in traditional Chinese medicine, observation is given the highest importance. Traditional Chinese medicine considers the human body as a systematic whole and that any changes in the visceral can be reflected on the body's surface. The thinking can be understood by considering that it is possible to see large-scale natural phenomena such as changes in the weather reflected in the movements of tiny creatures such as ants and dragonflies. In the same way, it is thought that the inner change of the body causes surface symptoms. Observation is a particular powerful diagnostic tool as the visual sense is very acute. Observation can be used to ascertain a patient's spiritual state, complexion, tongue, and to provide many other important bits of information that other diagnostic methods cannot. Experienced doctors can tell what the problem affecting a patient is by observing small changes in their skins, hair, tongue, eyebrow, and nails. This is the strength of diagnosis with the visual inspection. Actually, many other people have well-developed powers of observation. For example, experienced watermelon vendors can judge whether their wares will taste good or not, simply by observing, touching, listening, and petting the fruit. Another example of a precise diagnosis. Of course, in many cases, observation alone is not enough to identify a disease. Therefore, TCM practitioners use 4 diagnostic methods jointly for reference. The first 2 of these methods are listening and smelling. These involve listening to sounds and smelling odors. The third method is inquiry. This refers to the questions a doctor asks a patient or a patient's relatives. The fourth method is pulse taking and palpation. This refers to a diagnosis made by examining the pulse and palpating the patient. These four methods allow a TCM doctor to learn about his patient with his eyes, ears, nose, mouth, and hands. This allows the doctor to make a comprehensive analysis based on a wide variety of information. In turn, this allows him to reach a conclusion according to the thinking of traditional Chinese medicine. This is called the synthesis of the four diagnostic methods. Information contained in sound and smell. Traditional Chinese medicine places a high regard on the diagnostic methods of observation, listening, smelling, inquiry, pulse taking, and palpation in the early classic of traditional Chinese medicine, Nanjing, in English, Classic of Difficult Issues. Auscultation and olfaction, that is, listening and smelling, were given the same importance as the other three diagnostic methods. There is a saying, those who can make a diagnosis with observation are the divinity. Those who can make a diagnosis with the listening and smelling are the sages. Listening and smelling involve an assessment of the various sounds and the noises that a patient makes. Listening examines the following: the voice, language, breath, cough, vomit, eructation, deep sigh, sneeze, snore, and borborygmus. Smelling involves smelling any abnormal odors given out by the sick body. It also involves smelling the odor of any ejections from the body and the odor of the sick room. Disease and ailments create pathological changes in the viscera and the rest of the body. This is thought to produce changes in the sounds and odors produced by the human body. This means that by examining these changes, a doctor can identify what is happening in the body and offer a basis for a clinical diagnosis. Listening and smelling were created and developed gradually by doctors over a long period of time. As early as 2,000 years ago, the Huangdi's inner classical medicine put forward the theory of interlinking the five sounds with the five viscera. Zhang Zhongjing also highlighted the importance of assessing a patient's voice, cough, breath, groans, vomit, and the rumblings of their bowels. This advice was contained in his works, Treatise on Febrile and Miscellaneous Diseases. The theories are still widely used in clinical diagnosis today. Indeed, although the scope of listening is somewhat limited, it is widely used in the daily practice. For example, the deep sigh, like is an item assessed during listening. This refers to the sound of a long and deep breath that has an audible expiration. If a patient sighs frequently, it is thought that they feel depressed and they are trying to seize this feeling by taking a long and deep breath. The deep sigh is therefore a symptom of stagnation caused by emotional hurt. It is therefore thought of as the sound of emotional changes. This mirrors what happens in everyday life when someone sighs because they feel depressed. The characteristics of coughs and vomit are also used to make diagnosis today. For example, information on the type of a cold a person can come from the sound of their snuffles and sneezes. Since the Eastern Han Dynasty, doctors have included an assessment of the odors of the sick body and the sick room in their work. For example, people with critical diabetes are known to smell of rotten apples, while halitosis, that is bad breath, the most common type of abnormal breath, is thought to be caused by stomach heat. Its TCM treatment is therefore not limited to brushing teeth or chewing gum, but also involves clearing the stomach heat. Overall, as they have become improved by experiment and practice over time, auscultation and olfaction, that is listening and smelling, have become important TCM diagnostic methods with important clinical significance and value.